Welcome to my channel, Dr. Gold. Today we'll talk about leukemia. First, we will define leukemia. Leukemia is a cancer of white blood cells characterized by the rapid growth of abnormal blood cells. Here is a normal cells and abnormal cells production in which increase white blood cells. So now we will discuss about causes and risk factor of leukemias. So the exact cause is unknown, but some risk factor that lead to leukemia. It include intense radiation, benzene, also human T-cell leukemia virus, some family history, age greater than 65 years, and also posterior any cancer treatment. Types of leukemia. There are two types of leukemia: lymphoid leukemia, myeloid leukemia. Lymphoid leukemia further divided into acute lymphoid leukemia and chronic lymphoid leukemia. Myeloid leukemia further divided into acute myeloid leukemia and chronic myeloid leukemia. Now we will discuss about hemopoisis. So there are two types of bone marrow. The first one is red bone marrow and yellow bone marrow. And the hemopoisis occur in red bone marrow. Red bone marrow presents stem cells. Stem cells differentiate into myeloid stem cells and lymphoid stem cells. Myeloid stem cells further divide into megakaryocytes. These megakaryocytes further differentiate into platelets, reticulocytes. Reticulocytes further differentiate into red blood cells and mast cells. And the last one is myoblast. Myeloblast further differentiate into neutrophils, eosinophils, basophils, as well as monocytes. And lymphoid stem cells further differentiate into lymphoblast, and lymphoblast further divided into T lymphocytes, B lymphocytes, and natural killer cells. Monocytes further differentiate into macrophages, and the T lymphocytes and B lymphocytes further differentiate into plasma cells which produce antibodies. So in hemopoiesis, at the stage when these myoblast and lymphoblast, the abnormal production occur in the myoblast and lymphoblast in the bone marrow, so it goes to the bloodstream. In bloodstream, it increase blast cells, as well as in bone marrow also increase blast cells. Acute leukemia further divided into two types: acute lymphocytic leukemia and acute myeloid leukemia. So in chronic leukemia, at the end stage of hemopoiesis, the immature cell production occur in the bone marrow, which include neutrophils, eosinophils, monocytes, T lymphocytes, and B lymphocytes, and it goes to the bloodstream and increase white blood cells in immature white blood cell in marrow as well as in blood. Chronic leukemia is further divided into chronic lymphocytic leukemia and chronic myeloid leukemia. So clinical presentation of leukemia. Overproduction of white blood cells can decrease other cell production in bone marrow, lead to, if there is a decrease in platelets, it may lead to thrombocytopenia that occur ecchymosis and bleeding. If there is a decrease red blood cells, so it may lead to anemia. Symptom of anemia is fatigue, increased heart rate, shortness of breath. If there is a decrease white blood cells, It may lead to infections due to immature and non-functional white blood cells. So also further symptoms include swollen lymph nodes, fever, sudden loss of weight, night sweats, and hepatosplenomegaly. These all are the symptoms of leukemia. So diagnosis of leukemia: first, complete blood count, then bone marrow biopsy from iliac crest, and flow cytometry. These are all the diagnostic tests for leukemia. Treatment of leukemia: and treatment of leukemia include chemotherapy. Chemotherapy, it kills fast growing cells including aggressive cells. Radiation therapy, it help to kill cancer cells that settle in organ like liver and spleen. And bone marrow transplant, it stimulate produce healthy cells in the bone marrow. Thanks for watching. If you like my videos, please subscribe my channel and press the bell icon.